Alliance organization and you personally, Sloan, was really disappointing. So these emails, 3,000 or so, absolutely demonstrate that this clinic existed, that it was planned, that it had a specific target of pediatric patients, that these clinicians had not been trained previously in these hormone treatments, but were going to provide them, and that resources were going to be directed towards this clinic, resources from funding to time to resident trainees. So for Waldron and other people like Representative Reeder to mislead the public away from what was really happening is incredibly disappointing. And on top of what we have already, a crisis in medical care with the amount of people in this country who distrust public health now after the COVID-19 lockdowns and the policies that actually hurt people that many public health and physicians were behind. Now, on top of that, we have this. I mean, it's really done a disservice to medicine, and I've never seen anything like it.
Right. ECU, for the record, was also perpetrating misdirections when it comes to COVID-19 vaccinations for kids. We're going to leave that aside, lest I get censored even more than I already have been as a direct result of this story. So let's just go through this story. It's pretty significant. So we kind of think we've got a pretty good timeline. So this wasn't set up. This clinic wasn't set up with a couple of, activist doctors. Far from it, actually. Emails indicate that the very top of the organization was involved, all the way up to the guy right underneath Michael Waldron, the CEO and the dean also of Brody Medical School himself. It was Michael Higginton, who was in emails show that he was involved in initial planning, as was the executive vice dean for the medical school. Two different department heads. This is significant, guys, because in medicine and in medical school, you've got things called services, right? Or departments, you would know them as. So two service leaders, not only pediatrics, which is deeply concerning, but also the chair of sort of family medicine here, right? They're involved in this for referring patients, for their expertise, for helping train residents, for a variety of things. So this is far from a little interview that somebody did and misspoke. So Michael Waldron is a bald-faced liar, without a doubt, as is Tim Reeder, of course. And so emails showed that these folks were mandatory. They were supposed to be there. What scared the hell out of me, Nancy, and I want to hear what you think of this. This Sierra Buckman is the director of pediatric research for ECU Health and Brody Medical School. At every step of the way, she was involved in every single step of the way, planning, execution, and running this clinic. Tell me, Nancy, why would someone who is the director for pediatric research at a teaching hospital be involved in this clinic, do you think?
Well, she's looking for ways to obtain more research funds and grants through this clinic, and direct patients into research projects and that type of thing. These emails confirm what you've been reporting on, Sloan, and what others have been reporting on regarding, for example, Ms. Buckman spoke at the ECU faculty convocation last year talking about this revolutionary pride clinic. And I believe it was her who was talking about how they were going to see minors without their parents, gender affirming care. And she called it revolutionary, which I would believe it truly is. And then the chancellor was sitting right there cheering her on. So the highest people in the leadership of ECU were well aware of this. A pediatric research coordinator. This is not an adult research coordinator. This is
nowhere in here, guys, is adult.
This is a person focused on minor research in children. And there is a lot of needed research that we need to develop in terms of like autism and childhood disease,
asthma,
diabetes, asthma.
Asthma's a big one. Yeah.
Obesity, exercise, psychiatric effects after the COVID lockdowns. There's all sorts of things public health officials and research coordinators like Sarah Buckman could be looking into, or projects they could be delving into that would service the needs of the North Carolina population. Instead, she's looking to get an experimental clinic started, which it did start, drive patients there to network for more funds and grants, and follow up on grants she's already been the recipient of, for something that in the list of priorities in terms of public health is not high up there. In addition, they're going at it from a very specific point of view. Everything I saw in those emails, and I looked through all of them, was about the benefits of gender affirming care. Nothing, no articles shared that question it or have concerns about it. And, Sloan, these period of emails were going on during the time of the shutdown of the Tavistock Clinic in England, which is major news. And you would think a clinic starting up for these child sex change resources would want to delve into that and say, hey, what happened there? What were the failures? What were the problems there? Are we rushing into something that hasn't been fully studied? None of that was discussed. So for a pediatric researcher to be so involved with all of this and not even bring up some of the concerns regarding child sex change, or what they like to call gender affirming care, yeah, really problematic.
Call it that. Yeah, no, they didn't even know. They didn't know their ass from a hole in the ground. They didn't actually know how to do this stuff. They didn't know how to diagnose it. They didn't know anything that I see. I think what happened was they got the money and they said, hey, we've got the money and opportunity, which is, to me, the worst thing in the world. Look, you have ECU, which is a mission-driven hospital, right? It's why it gets federal dollars. It's certainly why it gets our taxpayer dollars, of which it's gotten a lot. And almost $1 billion between UNC and ECU is my understanding, this biennial budget. They have a mission, and their key mission is to improve the health of 29 counties in Eastern North Carolina. There's no demand for this at all. They are, in the emails, they are creating a demand, and they want to do it quickly. In the emails, they want to do it quickly. There is a demand, though, and a tremendous need for an autism specialist. They lost Dr. Karen Stiles during this. Dr. Karen Stiles was their specialist who diagnosed and treated autism, and people would drive from counties all over to see her. Huge waiting list. She left during the time the clinic was planned. They have not replaced her, so they have a major hole in diagnosing and treating autism, which is my understanding. It in some counties it could be 1 in 75 in terms of occurrence. So you got something that there's no demand for. They're creating an artificial demand. They didn't, with this grant, Nancy, they didn't hire anyone new at all on this service. They took the existing staff that they had, and they're already down to bare bones. They took the existing staff to create this clinic. Now, you and I called the clinic, right? This is months ago, and I made an appointment, etc. And you were there, and I can play it for you again. They would get us in. They wanted to get us in that day or the next.
Yes, very
look, and in the emails they say, listen, we're not full. We got to fill this calendar up. Otherwise, we're not going to get any more funding. But now I'm hearing, we haven't verified, but I'm hearing from people who are in Pitt County that it takes up to 7 months to get on the books for a physical in this same department with these same people. So a diverting of funds is important. That a donor, a private donor, could come in, like a Bill Gates or a George Soros, God forbid, come in and say, I want to test out cocaine on children. I mean, something as dangerous, maybe even more, I don't know. And the mission of the hospital is thrown in the garbage can so this can be pursued. And I think that's why Michael Waldron lied, because see, the budget time and all that, and he knew damn well that if legislators knew and the public knew that the money would be spent for, I don't know, stuff that's not supposed to be spent for, or that the clinic was working on other stuff from a private donor, maybe they wouldn't get that money. And I'm hearing that Tim Reeder, as recently as today, is still telling legislators, nothing to see here, guys. Why aren't we going after UNC? Why are we picking on ECU? There's nothing to see there, because he knows he knows what this shows, and he knows people are going to be mad, and he knows that there's a chance that his school, his employer, will not get money from this biennial budget, or certainly won't get a lot of money. I think that's becoming more and more clear, Nancy, as the days go by.
I think it's a very plausible hypothesis. I think it makes a lot of sense. I mean, the CEOs, they're responsible for bottom line. They're responsible for PR about their school. So it makes sense that Dean Waldron would want to downplay this, that Chancellor Rogers, which we saw in the minutes of certain Senate faculty meetings, or faculty Senate meetings, whatever they are, when he was questioned, downplayed this.
Well, he lied
Because
about it. He said, we're not doing surgeries,
right,
and the information is false.
right.
You know what? There's so much of those red herrings. We're not even dealing with that. I'm not going to even dignify that with a response.
Right.
They knew they were going to lie. They knew that they settled on the particular disinformation campaign that they were going to use, and they just kept pressing through. And it was Chancellor Rogers. It was Mike Waldron, which is irresponsible. He should be fired. This man is the dean of ECU Health, or excuse me, of the Brody Medical School, and the CEO of one of the state's biggest hospital systems. No, he needs to be fired.
Yeah, I agree with that. I think this was atrocious behavior on his part. And Timothy Reeder. And we also know Sloan, the North Carolina Medical Society, which I've never been a part of and have no interest in being a part of, that Timothy
Not
Reeder.
many doctors are. Not many doctors are part of North Carolina Medical Society. We're going to give you a number, but we're thinking it's about, cursory view, Nancy, 3% of all doctors practicing in North Carolina.
Yeah, I think personally, from my personal opinion, my research into that organization, it's pretty flaky organization. Very activist oriented, politically oriented. They have some interesting web education hours that I would rather stick a fork in my eye than watch. But we know Timothy Reeder is a leader in this organization. We know one of the first things he did when he got to the legislature, even though he advertised on his own webpage that he was for limited government and conservative values, was expand Medicare, which is a government program. This is something in line with the North Carolina Medical Society and what they want. We know that the North Carolina Medical Society was very proud of gutting House Bill 808, which was the Youth Health Protection Act, which would have banned not just surgeries, but hormones in minors for gender identity, which again, these hormones are non-FDA approved. There's no good research surrounding them, whatever they like to say. The research is very poor. They have no control groups. They have no long-term follow-up. The idea of treating a child's mental health with a cross-sex hormone like testosterone or estrogen makes no sense to me. So we know the North Carolina Medical Society, which I believe at one point you tweeted out, made a video proudly bragging about how they got this bill essentially gutted. Timothy Reeder, the leader of the North Carolina Medical Society, is on the committee that handled that bill. So I would imagine if they were able to gut it through him. So he's basically working against all of the values that he advertised to his voters in ECU, and is protecting ECU and the North Carolina Medical Society, in a very major way, rather than protecting children. And I think the Republican Party needs to do something about that.
I do too. So just to be clear, they back sex change surgeries for children without parental consent.
Right.
The North Carolina Medical Society backs, children having sex change surgeries, obviously irreversible, although they'll probably make the case to the contrary. They back doing this without parental consent. That is a position that may even be to the left of Planned Parenthood. That is the organization that Timothy Reeder, who masquerades as a Republican in Pitt County, backs. This is so explosive. I don't even know how to say it. There's a lot more news that we're going to drop about North Carolina Medical Society. I will tell you that. I mean, they are backed by Pfizer. Pfizer is strong in the market of sterilizing children and coming up with bogus studies. Pfizer came up with one of the most ridiculous disputed studies that's been done to date on these treatments, saying that, wow, it really does a teenager or a youth person very good to have puberty blockers and sterilize them. It does wonders for their mental health. That's Pfizer. Pfizer pretty much owns Timothy Reader also. So we've got, is Timothy Reader trying to be a thwarting the parental rights bill, which we know he's done, and the gutting of the bill? Is that happening because he's trying to, because he knows that ECU already received grant money? They can't give it back, so they know they got to do that. Is he protecting ECU? Is he protecting Pfizer, who is one of the biggest donors to the North Carolina Medical Society? Or is he protecting the North Carolina Medical Society itself, which is on record saying, we want the doctors to be able to treat and give abortions to kids at any time? He has several masters, but the people of North Carolina are not one of them.
Yeah, it's concerning. These relationships, not just the relationships that he has with ECU leadership and with the North Carolina Medical Society, but in conjunction with and in the context of what he has said in terms of initially denying this clinic and then saying, well, it's really not a big deal, we need to focus more on UNC. I mean, this is very confusing to me, and I don't trust anything he says at this point.
No, he needs to be removed. I've called for him to step down. I don't know if he will. We're going to have a press conference tentatively scheduled for Monday in Greenville. We will let you know more about it, but we're going to be mailing the article that we just published today to 20,000 people in Pitt County, 20,000 registered voters, so that they can know what's going on in their own backyard, because they're being lied to. We're going to be in Pitt County. We're going to make Pitt County ground zero. And we're going to show people what standing up looks like, because we're not going to allow this to happen in our name, period, point blank. So yesterday, about 10 minutes after you and I walked out of Representative Cleveland's office with those thumb drives, the ECU police started following me on Twitter. Now, you can look at my tweets. You don't have to follow me, right? You can take a peek at people's stuff. When you follow, they know you're following, right? Because you get a little notice. So that happens. And a few hours later, my Twitter account was disabled. And at this time, you still cannot find me on Twitter. And so I believe strongly that this is ECU. This is an intimidation tactic. It's coming from Mike Waldron. And I'm going to fight back. I'm not going to stop talking. I'm going to get louder. We're using various channels to do that. Timothy Reader knows. You can just call him and ask him. We're going to tell everyone in North Carolina what's being done in their name. And I'm hearing, Nancy, incredibly, that the Youth Protection Act, they're not going to move on it at all.
Yeah, I don't know what they're thinking with that, because you have to get ahead of this stuff. I mean, it's already in the works. You've got tons of doctors indoctrinated in this. You've got the American Academy of Pediatrics, not just the North Carolina Medical Society. You've got the AMA and National American Medical Association, which is related to the North Carolina Medical Society. They're all indoctrinated in this stuff. They all want to do it. They all want to bring it to kids. They want to bring it to kids in the most rural areas. They want to see kids without parents involved or their consent. And so for the legislature to not move on this bill at this time, especially now that we not only have the doctors themselves saying that they want to do this to kids, we have recordings from the clinic offices saying they're going to do this to kids. We have emails planning this for a year and saying they're delivering this stuff to kids without talking about any of the side effects, negative side effects of this, without considering any of that. Mm-hmm. All just the sense of urgency in terms of we must deliver this gender affirming care and these things to kids. The fact that the legislature isn't moving on bringing this back, 808, makes no sense whatsoever. And it makes me question who else is involved in wanting these clinics to happen at the legislative level.
I mean, sports betting, though, if you want to place a bet on sports, at a sports bar or what have you, you'll be able to do that. But you won't be able to protect your kids from these schools. Now, see, ECU, the reason why they're on our radar, Nancy, is that they're recruiting children in schools. Duke is recruiting children in schools behind the backs of parents.
Mhm.
So we need the damn parental rights bill to make sure that is curtailed. That's another thing that Timothy Reader doesn't support. Doesn't support that either. This is a very, very big deal. They are coming for our kids in our schools. They
Mhm.
repeat that. They are coming for our kids in schools. We have proven it. These emails also prove it. We
Yeah.
we we have done a FOIA request and got back the actual presentation that ECU uses to train elementary school teachers to get them referrals. So we have that on the outside of the clinic. Now we have it on the inside of the clinic. In fact, we know for a fact this is the first time in North Carolina that we've gotten a peek inside of one of these nightmares, child sterilization clinic, the first time. And because of our reporting, we have shown you how it works, literally from the classroom to the operating room.
Yeah, they're infusing it in all these schools. You could see it all over the place, especially, June being Pride Month. You've got Target, you've got corporations, all of them all working together to bring the language to children so that they repeat it. And then the modality of treatment, which is gender affirming care,
Yep.
means that you affirm what the kid repeats. So if the kid says,
At McDonald's Happy Meals, put a toy in that damn thing, they're going to want it, right?
right. So it's positive reinforcement. The kid gets special attention, special treatment, and then you have to reinforce what they want to do. So if a female toddler says they want to be a boy, you have to affirm that, and you support the fact that they want to be a boy. So they continue to want to do that. They're introducing the language, they're introducing the culture, changing the culture, and then creating this gap between parent and child, because they do it behind the backs of parents. Parents can't ask questions.
That's right.
If they do, they're deemed transphobic, homophobic, hateful, whatever.
Doctors
And
are the best. Doctors are the best. You throw on a damn white coat, buddy, and you get to make decisions for the damn parents. That's you, North Carolina Medical Society. That's you, Timothy Reader.
Mhm. And for the older children, then that sets up an additional fight between parent and child. So the child can go in and say, I learned about this. And the parent says, well, that's not really reality. That's not really how it works. And then the parent and child are at it, and they're setting up this disruption of the parent-child relationship. So yeah, we've seen it going on. I have personal experience in a private school where they were showing these types of controversial materials to my kids as young as first and third grade. Fortunately, I was around to catch it. So I know personally it's going on. It happened to our family. When we were able to do something about it. Unfortunately, a lot of parents don't have those resources to do something about it, aren't around often enough because they're working or whatever else to see what's happening in the schools. And then these physicians step in and take advantage of the situation. And it's very sad. It's very pathetic, and it's unethical. And they need to be held accountable.
Well, yeah, it is. I mean, so you've got in Eastern North Carolina, you've got a lot of hardworking people, and a lot of the area is very low income. And so maybe you're going to have two parents that are working all the time. Okay. Or maybe you're going to have a one parent home or whatever. And you're going to have parents that are not able to tell this. Now, ECU also, they have telehealth going into these schools. So they're going to get these kids. I mean, they're going to get them one way or the other. They're making it clear. And by the way, they're intending to keep doing this, because they're the way they're dealing with this is they're going to lie and ride or die. They are going to die on this hill. And I'm telling you, ECU and UNC have a merger on the line here. We are about to consolidate healthcare so that the only place that there is to go is ECU and UNC for a lot of these rural areas. And I'm telling you, for the legislators not to do something on this, shame on them. We're going to call them out. We're going to call them out. You know, people criticize us like, I don't give a damn, actually, and say, well, do you have another candidate lined up? Do you have another Republican? That's not my job. My job is to make sure that the people that say they are running to do X, Y, and Z and stop this, that they keep their word. My job is to go after the people in the majority who have the power. My job is to make sure whoever is responsible, no matter what their political party, for upholding this, starting this, that they are brought to accountability. That is our job here at First Alliance, and you can count us to keep doing that job.
Yeah, it's just asking the question. All I want to do is find out, okay, what is the truth? What is happening? Who is doing it? Where's the money coming from? I could care less about the political party doing it or not doing it. The point is that people need to know what's happening in their physicians' offices, in their school classrooms. They
behind
need
the backs of the parents.
right. And a lot of people don't realize it, but once you show them, these words, diversity, inclusion, all of these things sound really good. And who's going to be, why would you be against that? But once you show the parents and once you bring the practical results of what they're doing in the name of things like quote unquote inclusion, people, the majority, and they've shown this in survey after survey, whether it's Rasmussen reports or whatever survey, the majority of Americans do not want this. They do not want this in their home. They do not want this dichotomy between parent and child, and that these representatives are not stepping up, not just not stepping up, but trying to distract parents from these issues is untenable. I won't stand for it.
No, none of us will, and a lot of people won't. I'm hearing that Greenville is absolutely on fire right now, as it should be. So, yeah, so we're going to get as many resources down to Greenville as possible. We're getting ready to kick off a fundraiser. We're going to do this on Monday. The fundraiser, we're going to raise money to send, again, 20,000 voters or residents who need to know that they're predators in their own midst, and they call themselves doctors. We're going to hit up Greene County for that. We're going to hit up a couple more counties, definitely Greene and Pitt County. And Chris Humphreys, where are you, dude? I haven't heard a damn thing from you. You represent these people, and yet I'm not hearing from you at all. If we find out that representatives are lying about this, we're going to have to double down. Nothing worse than a lying politician. And the penultimate outrage is a lying politician and doctor and lobbyist all rolled up into one, and that happens to be Timothy Rader. We don't like it.
Yeah, I mean, the fact that he so aggressively denied that this was even happening, and
yesterday did it. Yeah, even
yesterday. Of doctors being interviewed about it, clinics being recorded about it, faculty convocations bragging about it, his own medical society bragging about lobbying against the bill to protect kids and their parents from malicious actors acting behind their back, that he was so aggressively denying this and personally attacking you, Sloan, and Ed First. And now we have this whole cache of emails that confirm that not only were they setting this up and did set this up, but they were doing it with a very particular motivation, targeting particularly kids, without any consideration for the side effects of what they were doing, without any discussion of Tavistock, without any discussion about questioning social contagion. In fact, all of the materials were trying to debunk that.
Yeah, I saw that.
Yeah, that issue. It's very scary. And, Timothy Rader isn't just a politician. He took an oath. He's a physician. And that's why I hold these physicians higher, because they did take an oath. And you work really hard for your reputation as a physician and as a person. And for people like him to destroy trust in physicians, in people who took an oath, and all of the physicians who want to do the right thing, shame on him. I have zero respect for it.
Yes. So as you can tell, we have got a lot of strong feelings about this. This is the first tranche of reporting that's coming out. We have at least 3 more reports to go. We're really going to dig into this. We've got more FOIAs outstanding. FOIA is on the federal level, but people understand that to mean a record request. So we've got some more outstanding, should be getting some back as soon as today. We're not going to stop. I mean, we're not going to stop until this is completely shut down. And we are targeting, Eastern North Carolina. We pray for the families, seriously, pray for the families of Eastern North Carolina, because they are being taken advantage of, whether it's, Nancy, as we talked about, diverting care away from treating childhood diabetes, maybe childhood cancer, God forbid, autism, we know for sure. to being sexualized and treated with these medications. This is a very dangerous, precarious time. I want to hear from Jim Perry. I believe that he'll do the right thing. I know that John Bell is outraged about this and has expressed concerns. I know that Kidwell, and I know that others, I know Jimmy Dixon is extremely upset. We know Representative Cleveland, they're upset and they publicly said so. I'd like to hear from Chris Humphreys, and I'd like to hear from others about what they're going to do about this. We better hear some hell raising from you guys too. So the grassroots, man, if you're not calling your representatives and you're just sitting here thinking we can do all the heavy lifting, I can't help you.
Yeah. No, you have to get on the email. You have to get on the NC legislative.
Pick up the phone and call.
Call. I mean, not even, don't even email, just call, leave a message, call them again the next day, tell your neighbor, share the article, tell them to call. People don't like to believe it. It's natural for human emotion when you see something that's so horrific, especially geared towards kids, that you don't want to believe it, that you want to look at these articles and say, no, this isn't real, or this is just a one-off, but it is real. And Sloan has been following the story for months. It's real on several levels, on the physician level, on the university level. They're bragging about it. Like, we've gone through all of this now, behind the scenes emails. So you have to tell your neighbor, yes, this is real. This is really happening. You're going to have a gut visceral denial response where you're not going to want to believe it, but you have to call the legislature. You have to call your representatives and your senators and leave a message and tell them you're not going to put up with this.
Everyone involved in this, as a doctor, you are a monster. You are a monster. You are totally ignoring the studies that are coming out of Finland, Sweden, Tavistock. They've been doing this for over a decade. You're ignoring the 1,000-person and growing lawsuit against Tavistock for ruining the lives of children and families. You are monsters. You need to renounce what you're doing right now. Stop hiding this. Stop hiding. Stop lying. Stop doing this. Everybody involved and everybody covering it up, you are just as culpable.
Yeah.
So I'm going to leave you with that. Stay tuned. We're going to have another report coming as soon as tomorrow. And please share this video with 10 people. Share the article that's going to come out with this video with 10 people. Just do it. All right. All right. Well, have a good evening. And thank you, Nancy.
Oh, thank you, Sloan. I mean, this is amazing work, and North Carolina owes you a lot for exposing this.
Team effort. Takes a team. So thank you, and pass this on to 10 people.